Right, this was one of our top stories this afternoon, the outbreak of the gastrointestinal outbreak that has claimed the lives of 7 people. Close to 70 patients are receiving treatment at the Jubilee District Hospital. Departmental Health officials are believed to be at that hospital. For more on this, let's now bring in the Gauteng Health Department spokesperson, Motalatale Modiba. Motalatale, thank you for making time for us. As things stand now, how many people in your records have been affected by this outbreak? You had confirmed previously that 6 people have died.
Yes, thank you, Clement. As of yesterday, when we gave the last update, we had spoken of a number of 7, which was the latest figure at that time. And also, we had indicated, if I look at my stats here, that about 67 people were seen at the hospital. Currently, as you and I are speaking, the MEC for Health, together with the MMC for Health in the city of Tshwane, they are both at the Jubilee Hospital now, currently receiving an update from the officials in terms of where we are sitting with the latest stats, and also hopefully getting the outcome of the tests that have been done. As you recall that we indicated that we have sent tests to the lab so that we can be able to confirm as to this diarrheal infection that we're currently dealing with, what is it exactly? And we're expecting that just shortly after the briefing that the MEC and the MMC are currently having, they will be able to update the nation in terms of what the outcome is. So they are currently in that briefing as you and I are talking.
Yeah. What is the source of this outbreak? Have you been able to establish that? Some residents in the affected areas are saying it could very well be tap water.
Look, at this point in time, obviously, stools were taken to go and be tested. The water samples were also taken to go and be tested. And part of the update that both the principals are currently receiving as we're speaking is to also get the feedback in terms of those particular outcomes. And that should then be able to tell us what the source of this particular outbreak is. What we have been doing, though, is to emphasize your preventative and your safety measures, because we've got diarrheal disease. The symptoms are more or less the same within the family of those diarrheal diseases, and in terms of the preventative measures that people can take and what they should be doing, things like not drinking water from polluted sources, your streams, your rivers, or where they suspect that water could be polluted, we're saying stay away from that particular water. But where people say we can't stay away from the water, we're also advising on what to do. Things like boiling your water first, at least for 1 minute, to allow it to boil where you can see the bubbles. To say if you've got that water that you need to also put a teaspoon of household bleach into your 25 liters of water, allow it to stay overnight, So we're giving that kind of advice, but most important is the issue around making sure that we maintain basic hygiene, not eating food that you suspect might be contaminated, but also when you're handling food, making sure that you wash your hands with soap so that you then don't contaminate your food, but also even when you're coming from the bathroom. So our teams that are on the ground, especially the guys that are doing the outbreak response team and your public health educators, they are on the ground spreading that kind of message, because part of us being able to stem the spreading of this disease is to ensure that we maintain basic hygiene.
Yeah, our viewers are looking at live visuals now from that Jubilee Hospital where the Gauteng Health MEC, Nomantunko Moralehoko, is receiving that briefing from the hospital staff. And as Motalatale said, we'll get an update on the current number of people that have been affected. One, those that are being treated, but also those that have unfortunately died from this outbreak. Motalatale, do you have specific areas in Pretoria that you're focusing on?
Yes, there are certain areas that we are focusing on. The main area is the Hammanskraal area, in particular Kanana, Greenfield, Surman, Majaning, and other surrounding areas in that particular area, because when we got the reports from the beginning of the week up to Friday, what we noticed that more people seemed to be coming from the Kanana area. I think one of the reports was saying almost a higher percentage was people coming from the Kanana area. So those particular areas that are around the Hammanskraal area is what we're looking at. We will hear, I think, when the officers are giving feedback as to are we seeing people from the neighboring Stingvater and the other areas there that should also be worried. Because if you're talking about Majaning, you know that Majaning is close to Lepengville as well, and there could be those other areas that are nearby. So those are the areas that we're targeting. But for now, our message is that the whole of Hammanskraal, we're just urging communities to take precautionary measures. You rightly have said earlier on that the City of Tshwane has also issued a statement from their side where they are communicating the measures that they are taking. And in fact, they have said people should not drink tap water there because they are providing water tankers and other means, because they have also taken their own water to be tested to check as to could there be a problem with the water and everything. So I think at this stage, until we get the finality of what exactly is the cause of the problem and how we're tackling it, it's just for people to exercise extreme caution, given that we already have fatalities out of this particular incident.
All right. Motalatale Modiba, spokesperson for the Gauteng Health Department. Thank you for making time for us.